with introductions. And so if you could just start by saying your name and your organization, that would be great. And Heather, if we could start with you.
Sure, I'm Heather Cicarelli. I'm from the American Cancer Society.
And Lori?
Can you hear me okay?
Yes.
Okay, this is Lori Dyer. I'm the Oncology Nurse Navigator at St. Mary's Center for Cancer and Blood Disorders.
Cersei?
Hi, Cersei Damon, Nurse Practitioner for New England Cancer Specialist at Mercy Oncology Fall River.
Okay. And Michael?
Michael Reisman, Executive Director of the Beth Wright Cancer Resource Center located in Ellsworth.
Okay. Annabelle? I'm gonna unmute you. Oh, it's okay, Annabelle. If you can hear me, we'll come back to you. Barb, are you there?
Hi, Barb Perry from the Maine Health Cancer Care Network. I'm the Survivorship Program Manager.
Thanks. Mona, I think I heard your name as well.
Yes, Mona Irvin. I'm the chairperson of the Maine Coalition to Fight Prostate Cancer.
Okay.
And Michael is on our...
Sorry, Michael is what?
On our board of directors.
Oh, okay. Great.
He serves double duty.
He has a lot of duties. So, is there another person on the phone?
Hi, I'm Kim from New England Cancer Specialist.
Great, thanks for joining us.
Hi, Kim.
Hi.
And I'm Christine from Northern Light. I'm a social worker and financial navigator here.
Okay, great. Kim, could I ask your last name?
Oh, sure, Shaw.
Shaw, okay, great, thank you.
Mm-hmm.
And Annabelle, are you able to?
Hi, Annabelle Harcourt, New England Cancer Specialist.
Great, thank you.
Hi, Cersei.
Hi, Annabelle.
I wonder sometimes how many of you are calling in from the same building, but different offices. All right. Well, thanks again for tuning in today. I am going to move to sharing our PowerPoint presentation. You should see that on your screen now. Today's topic is patient empowerment, and our presenter for the didactic portion of this ECHO session is Heather Cicarelli, and our case study presenter is Michael Reisman. And I'm going to let them introduce themselves in just a moment. But before I do that, I wanted to ask you, if you're not talking or while the presenters are presenting, if you could please mute yourself so there's no background noise. And then throughout the presentations, or at any point, feel free to put some messages in the chat box if you have any questions or comments or any trouble with technology. You can also call our main office here at Maine Cancer Foundation if you have any problems, and the number is right there, 773-2533. We do have some ground rules for during the session, which is, like I just said, if you could please keep your phone, your microphone on mute. And if possible to show yourself on your video, that would be wonderful. And just remember that we all can see you on video. And when discussing patients or anything like that, if you can make sure that you do not share any identifiable information and just use de-identified information or descriptors. You can also raise your hand if I can see you, and I will be paying attention to see if I can see you, or there's an option in Zoom as well. Also, if you could speak loudly and clearly, and I think we all know how to do this, but keep questions and comments on point. And those are the ground rules. Are there any questions before we get started?
I think just one other thing that I'd share is if you do have any questions or if you need any help throughout the ECHO, just feel free to type a message into the chat, and I'm here to help with any troubleshooting. So please feel free to type any questions.
Oh my gosh, I forgot to ask you to introduce yourself. I'm so sorry. This is
completely fine. So I'm Caitlin, as Aisha said, Caitlin Michaud from Maine Cancer Foundation, and I'm a program manager here focused on our grant making. So I'm supporting this ECHO work.
Yeah, sorry about that.
No worries.
Okay, all right, now we're all settled. Heather, if you could just let me know when you would like me to advance the slides, just say next and I'll move it along. But I hope it's okay to just let you introduce yourself.
Sure. So I am Heather Cicarelli. I work for the American Cancer Society. I'm actually the senior manager of our patient navigation program for the Northeast region. So I have patient navigators in New England and in New York City that I supervise. And in the state of Maine, we have 2 American Cancer Society patient navigators, one Magda Alden, who I know has presented on here and is an expert in lots of things. And she's at Maine Medical Center, and we have a newer person up at Maine General, Katie, and looking forward to getting her a little more involved in networking and learning from some of her peers as well. So I wanted to start by saying that I blatantly copied and pasted and took, photo clips of material that's sort of out there. So this is just a broad overview and sort of a teaser of some trainings that are to come. But I thought it would be a good opportunity for me to share some information about some work that's been going on around patient empowerment and really more specifically patient activation. So if we could go to the next slide. So this is what I hope that you're going to get out of today. And patient empowerment certainly can influence patient outcomes. And as Michael was just kind enough to remind me, not only in the hospital setting, but also in the community center. And as they kind of continue their journey towards survivorship, and actually patient activation or being empowered is something that helps in your overall journey, not specific to just cancer, but that's what I'm going to talk about today. We can go to the next one. So patient empowerment, there's a lot of, it's sort of a jargony kind of word, and people love it or they don't like it. There are a lot of definitions. This is the one that I pulled out that I think just sort of captures a lot of the ideas. It's, sort of in the cancer world, the term survivor has different interpretations or definitions depending on the group, and I think the same is true of patient empowerment. But that we are finding that in the changing healthcare world, that the expectations of patients are very different than they were even 20 years ago. So if we think about even the shift from cancer treatment from the inpatient setting to the outpatient setting, or even the home setting, there's a lot of burden or responsibility on the patient. And I'm going to talk about kind of getting patients activated. So the next slide, actually we can go right to the next one. So patient activation really has to do with patients' knowledge and skills and their competence to manage their health and health care. And next slide, please. I wanted to talk a little bit about a program that is soon to be available through the American Cancer Society. I don't think they have an actual live date yet, but they have promoted some information on the website. The link is the last of my slides today that will give you an opportunity to sign up. But essentially, the premise, and there's evidence of this that came from a multi-year study that we did with funding from the Merck Foundation in some looking to address cancer disparities. So there were different pilot sites, and they trained navigators to coach patients to get them more engaged and activated in the thought that it would help people complete their treatment. So this is just a brief summary of what the program is. And then the next slide, please. So this talks a little bit about sort of the basis of the program, that it's a coaching training to help with oncology navigation, to show that patients can be, that some patients can in fact use action plans and skills and overcome some barriers to care, and that helps them to have overall satisfaction and also helps with some patient outcomes. So the next slide, please. So this is a summary of the process, and I actually put this slide in a lot to kind of remind us of where we are. So my apologies, Michael, this talks about navigation, but I'm sure that there are many ways that you can talk about somebody meeting with somebody in a community resource or another role. But if the patient comes in and meets with the patient navigator, the first thing that they're going to do is identify through a series of questions or a survey, identify the patient's activation level, some of their barriers, and set some goals. They're going to work on the goals. There's going to be some follow-up and check in around those goals, and then hopefully there'll be a better health outcome and better quality of life. So if we could go to the next slide. So these are some of the skills that will come along with the training. And I'm actually kind of going to cram like a 3-hour workshop into a 20-minute overview. So just sort of a taste, but we can go to the next slide. So activation and engagement is important throughout the whole cancer continuum, from prevention all the way to end-of-life care. There's lots of decisions, there's lots of appointments, there's lots of things that patients need to be responsible to do to be part of their care. What am I trying to say? Their care journey. So this sort of illustrates how it's important all the way along. It has to do with some communication issues, decision-making, quality of care, and also gets into health equity. So the next slide, please. So what am I talking about? When we take a look at activation, the training or the study has come up with, and I don't think this is original concept, but that there are 4 levels of an activated patient, and that people fall in different places on the spectrum. And the big idea behind the training is that you can move patients from one level of activation, that you can increase their levels of activation. So certainly the patients that we most often are referred to us are folks that have difficult diagnoses, maybe complex treatment plans. They may have multiple comorbidities. They may have inadequate or be uninsured. There may be lots of barriers to their healthcare that are preventing them from becoming more activated. And the thought is that with some coaching, that we can help them along and become more involved in their care. So next slide, please. So again, if we get back to the kind of the model of what the next process is. So once you've sort of decided what level they're on, so that you have a baseline, so you can sort of evaluate what work you've done, the next thing you want to do is identify some barriers and set some goals. So that's the next slide, please. So the method or the approach that is helpful to help with patients, to help them become more engaged or more activated, is a coaching strategy. So there are 3 parts to coaching. You're going to guide patients to think about and problem solve. So instead of telling a patient maybe what to do, we're going to have them come up with their solution or the way that they're going to overcome the barrier themselves. We're going to use questions and patient-centered communication skills to empower the patient to problem solve, maybe by asking what they've done in the past or what's been successful when they have been faced with a similar problem. And we're going to help the patients to make an action plan to achieve the goals that they want to set. And it's about the goals that they want to set. So next slide, please. So this is the coaching model. It's called the GROW model. So we have goal, reality, options, and will. And all along the continuum, the coach will be asking questions to help get from the goal to the commitment and the action plan to reach that goal. Next slide, please. So some of the assumptions of coaching that are important for the coaching model to be successful is that you assume that the patient is capable of problem solving and moving toward or achieving their goal. You assume that the patient is the problem solver and not the navigator. And you assume that coaching empowers the patient and can impact activation and engagement. And the next slide, please. So we also know that goals and plans set by the patient are more likely to be achieved. So I know that if I say, gee, I'd like to, walk 5 minutes a day this week, I'm much more likely to do it than if, my husband tells me I need to get out and walk more. So if I set my own goal, I'm much more likely to be invested in it. And we also know that not all patients are a good fit for coaching, and not all situations are a good fit for coaching. So there's certainly a time and a place, and there are some folks, and I'm preaching to the choir, right? There are people on our caseload or people that we meet that we know we can kind of give a little nudge, and they can manage one more thing, and we know that there are people that their plates are so full, there's no way that they can manage one more thing. So this is just a tool for your toolbox. It's not a one size fits all. So next slide, please. So we go back to the process. We've talked about sort of what model we're going to use, and now we're going to identify some barriers and set some goals. So the next slide, please. So this is an example as a primary barrier. So your primary barrier is your issue that's preventing a patient from being engaged in their healthcare or preventing them from seeking care. And that we know that coaching and supporting the primary barrier is the key to increasing activation. So if we offer a solution, but it doesn't address the primary barrier, then it may not, in fact, solve the challenge that the patient has identified as their priority. So in the triangle, we see some common barriers. So the patient missed their first treatment. The barrier is that they can't get off work because they haven't told people that they have cancer. So that's an example. There are lots of examples that we have. It's just to give you a sense of what we might be talking about. Next slide, please. So to coach patient to make an action plan, it's important that the action plan is made by patients, that it's broken down into doable steps, that it's individualized based on their activation level. So it's not that you have one action plan for everyone who needs a ride to treatment. It's that each one has to be created on an individual basis and be made by the patients, and they always require some follow-up that's specific to a task. So we can go to the next slide. So here's an example, and clearly I definitely just, copied and pasted this because it's got MD Anderson, but it gives a very common, I think, barrier, which is getting a ride to treatment, and sort of has broken down the steps that need to happen into very small steps. So like any other goal in life, if I say, I want to lose 10 pounds by Thanksgiving, first of all, may or may not be a realistic goal, but second of all, what are the things that I'm going to do to have that happen? Well, I'm going to eat healthy. Well, what do I have to do to eat healthy? Well, I might have to buy some healthy foods. And in order to buy some healthy foods, I need to get to the grocery store. Do I have a plan to go to the grocery store? Do I have a list? Do I know what healthy foods I want? So this is an example of getting a ride to treatment. How did we break down the steps that the patient needs to have or to take or be aware of because we need to make sure that we understand all the things that need to happen. So there's a sample there, and we can go on to the next slide. So that shows sort of how the person got from their goal, which is that, you know, we're going to have them call for their own ride to treatment, all the way to the detailed action plan. Now, along the way, you know, in this, if we were talking about transportation, the patient may say that they don't have a way to get there. You may have a conversation, how did you get here today? How do you usually get to appointments? What do you do when you need to get somewhere? Or what is it that's preventing you? Are you worried about medication or the side effects? Or, you know, do you just not have a ride? You know, sort of what is the actual issue? And then what are some steps? So if you go all the way through and the patient has identified, you know, I don't have any friends that I can ask and everyone I know works, or I haven't told anyone that I have cancer, right? So we're going to identify the primary barrier first, which is getting to the appointment. And then later we may go back and address the telling folks that you have cancer. So what's preventing you? What can you do? What have you done in the past? Sort of build on those successes. So the next slide, please. So as you know, kind of re-look at the model, right? We've gone all the way around. We're working on some goals. We've set some goals. And then, you know, we'll check in to see, did the patient get to the appointment? Were they able to arrange a ride? And then it may repeat, right? Because there's a follow-up appointment. Do you know how, you know, do you feel like you can call to get your next one? Where do we get, you know, et cetera, et cetera. So it is a bit of a cycle. And we can go on to the next slide. So that was just a super duper fast overview and sort of mixed and matched. So this is the link for the Take Action training, which is going to be rolled out. It's, I don't know exactly the timeline of that, but if you wanted to click on that link, you could sign up for it, and some of the slides that I used today are on there. I also took some of my information from the American Cancer Society, did a pre-conference seminar at the AONN conference about the Merck outcomes. So a lot of the slides came from there as well. And I know that there will be more to come. That was just a really fast overview of how involving patients and helping to activate them can improve outcomes. And we also know, and I should say, that it takes a lot longer, right? So it's a longer process to sit down and go through all that. But if you are, suppose, you know, you're making 30 appointments or 30 arrangements for transportation for a particular patient, investing a half an hour or an hour and teaching the skill at the beginning and breaking it down into small parts so the patient has mastery is going to, in the long run, sort of take less of your time. So you're investing your time up front, and you have also now empowered the patient for follow-up appointments or other kinds of community referrals. So I feel like I talked a lot, and I will stop and see if you have any questions.
Okay, thanks, Heather. Can open it up for questions. Feel free to jump in or type your question in the chat box.
And I'm sorry, I went a little over, but I talked as fast as I could.
Oh, no, that's great, Heather. It's a fluid session.
All right, thanks.
Yeah, Cersei, did you have a question?
Are there a group of patient navigators ready to go when someone accesses the website or the link? Like, is there a referral that comes from something, or does the provider have to refer? Does the patient self-refer? What happens? Did you hear? Hello?
Yeah, I can hear you.
Okay.
Do you mean like how patients get connected to a navigator, or are you talking about the training?
Kind of actually both are good questions. So can a patient self-refer in, or is there a provider that that refers in, or just kind of tells them about the website? Or
So the website is a training for healthcare professionals, not for patients themselves. So I'm sorry I wasn't clear
Okay.
about that at the beginning. It would be something that would be available for you or someone on your team to work with patients. So in the model that I work with, and most of the models that I hear, patients are referred to the navigator, right, because they have some sort of barrier to care.
Mhm.
Or in the clinical model, it's because, you know, they need to be guided through. So, you know, there may be some tasks that you're doing for patients that some patients can be empowered to do themselves and some can't, right?
I guess the word navigator is throwing me off a bit, just because of nurse navigators that are navigating patients through the system. So I feel like that's where I'm stumbling a little bit, you know, so it's not the same thing that we're using nurse navigators for. Am I right?
No, you're correct. You're
Okay.
correct.
All
So
right. I guess I was just confused.
the
Yeah.
non-clinical navigator, or you know, somebody who's helping to support patients. So even, you know, I think it would be a great skill for our financial advocates who, you know, I'm sure are empowering patients to do lots of the tasks that go along with applying for prescription assistance or assistance with medication costs. So
Yeah.
yes.
Okay. I see that. Thank you.
And I guess I'll make a kind of a plug, if you will, so I just came back from the National Navigation Roundtable that the American Cancer Society is a convener of that, but they do have 3 work groups or task groups that are made up of lots of different organizations and representing nurse navigation and lay navigators and non-clinical navigators and clinical navigators and community health workers, and really trying to come up with some, I guess, trying to move things forward in evidence-based practices and workplace development and policy. And that would be a great topic, I think, sometime for another webinar. So be interested in sharing that information out on another time.
Heather, is there any cost for taking the training or accessing materials?
I don't believe so. I think that it is free. I don't have a whole lot of details, but on that link at the end, there is a form to sign up to say that you're interested, and certainly I would think at some point we could do almost a train the trainer model. So, you know, there's a way to make it work, shall we say, which is the unofficial answer.
Okay. Great. Are there other questions for Heather? Well, I jotted down a couple. I'll just go ahead and ask. I was trying to think through how a navigator would work with a patient to empower them to access local resources. So how would that work exactly? I mean, the navigator, to prepare for these sessions, would they need a list of resources to have ready to go, or I don't know, just in terms of process?
Yeah, I mean, I think most navigators have resources that they commonly refer people to, but I think that this idea sort of dives deeper into that you can't just always say to someone, oh, here's a list of food pantries if you're struggling with food. You need to make sure that they understand the steps to go about to access getting in touch with that resource or using that resource. So what does it take from the here's a list or here's a name of a food pantry to that patient leaving with a bag of groceries perhaps? And how do you make sure that patients are confident that they have the skills to be able to do that? So I think, we're talking about starting with patients who have low activation scores or are at risk of not being able to complete or to be able to work independently, perhaps because of other barriers or other obstacles or being completely overwhelmed by their diagnosis. Did that answer the question?
Did, yes. Are there any other questions? Just a reminder, if you could mute unless you're talking, that would be great. Thanks. I did think of another question too, Heather, while you were talking. I was wondering if this program or curriculum or model has already been piloted or evaluated in any way.
It has. So there, and I don't, like I said, it's kind of snippets from a 3 or 4 hour presentation. So the American Cancer Society did a pilot study in conjunction with the Merck Foundation to reduce cancer disparities. I believe there were 5 sites, although there may have been a few more. There were 2 sites in the Northeast region. So one was a safety net hospital, part of the New York Health and Hospital Systems in New York City, and the other was a hospital in Philadelphia. And there were other sites, and they were really about helping disparate patients, sort of reducing their barriers to care or helping improve outcomes. So there was a very elaborate, so the tools that are coming out are the results of lots of training and mentoring and practice. The navigators that we have that are very successful at this, had intense skill training, had practice, had chances to sort of role play with how do you help a patient become more activated or help them move up the activation scale. It's a very different approach than someone coming to you and saying they need something and you providing a resource to them. It's sort of breaking down the task into successful parts, because how many times do navigators, whether they're nurse navigators or lay navigators or volunteer navigators or non-clinical navigators, do you go over and review something with a patient, and when they leave you think that it's going to happen, and it doesn't happen? And there are many factors that go into that, but these are some skills that you can work on with the patient to increase the success that they're going to be able to be successful in being active in their care. And it may be something as simple as coming back for a test or coming back for follow-up or acting on a recommendation. That it's one thing to tell someone that they need to go to the pharmacy and have something filled. It's another thing to make sure that they sort of understand, you take the prescription with you, you do this, or if you need drug assistance, how does that happen? How do you get from step A to having the prescription in your hand? So it is tested strategy. Like I said, I gave you just a quick sound bite of it, just sort of a taste. There's lots more information that will be rolling out from the American Cancer Society on the Take Action program.
I think you're
for what they do. signing up at the end is the way to get the most information.
Great. Thank you. I just had one more thought, which is that I appreciated you starting by saying that, there's some patients that activation may look like something very different for every patient. And then I imagine too, throughout the cancer journey, there are various parts of it. Let's say you're knocked out with chemotherapy side effects that you're not able to have the same level of activation that maybe you had 6 months ago. So I thought that was a really good point. Are there any last questions for Heather? No? Great. Heather, thank you so much for presenting. We really appreciate it.
You're welcome.
Thanks. All right, we're gonna move on now to the next part of our ECHO session, which is focused on a case study. And I am going to let our case study presenter present himself, but I do have his name and title here. So Michael, I'd welcome you to just say who you are. And I'm not sure everyone's familiar with the Beth Wright Cancer Resource Center, and then take it from there.
Okay, so I'm Michael Reisman, Executive Director of the Beth Wright Cancer Resource Center. We serve Hancock and Washington County. We've been active. We were established in 2004. We provide a lot of support services for people, such as support groups, complementary therapies at our center in Ellsworth. Plus, we do have outreach programs in different towns in Hancock and Washington County. We've worked very closely with the Maine Cancer Foundation. They've been supporters of the Beth Wright Center. So in conjunction with Healthy Acadia, we are doing a patient navigation program in Washington County. And one of the things I think our patient navigator does is try to empower patients to take control of their health and getting to appointments. And in Washington County, people have to travel 100 miles one way to get to the major treatment center. So there are some barriers to get to treatment, and empowerment is something that that program strives for. I was going to talk about it more from the Beth Wright Center resource. We're a center where people can come for programs, and it's coming from a different direction. And I think we could complement what the GROW program wants to do in one of the places. One of the ways that I think they can empower people is, in addition to taking care and getting to appointments and other things like that, it could be like going to programs that would benefit your health in other ways. And I think anybody who comes to the Beth Wright Center is probably at least level 2 as far as the activation point would be. So we are seeing more activated people. But one of the things is, I think, and we go through, and going through the case study, I think, giving an overview first, I think we offer programs where people can take part in and improve their self-esteem and improve their sense of control over their situation. So, I think we can supplement what would be going on with the GROW program. And so this first case study, and the one I'm focused on most, actually the man who came to this, the man with stage 4 renal cancer, was referred to the Beth Wright Center by the palliative care doctor at MDI Hospital. So that connection between the medical center and the community center is very important. And certainly the Dempsey Center in Portland and Lewiston and their Cancer Resource Center in Norway. There are more and more resource centers and where people can be referred to. But basically, he came to the Beth Wright Center to see what we had to offer. And we were able to sit down. Actually, I sat down with him to tell him about the programs of the Beth Wright Center, but also we ended up talking for about 15 or 20 minutes or even longer. And so one of the things for us is, and it happens often, is we had the ability to take time to have more of this organic conversation and to see where it would go, to see what his interests were, to explain what the Beth Wright Center was about. And in the process of this talk, we found out, he told us that he'd been a maintenance supervisor for a seasonal business. He had a lot of responsibilities. He had moved to this area 5 years before because he wanted to change his lifestyle and again indicate that he has a lot of self-motivation, I think. And then then he was diagnosed with cancer, and he was hit in the, smacked in the forehead. Totally, he no longer could work. He had financial issues. He had to move into a smaller apartment, and he did have a sister in the area who he could rely on. But basically, when he came to the Beth Wright Center, his life had changed drastically, and he had a cancer that wasn't curable, and he was trying to put the pieces together of his life. And he did end up taking advantage of our programs. He took a Qigong class, which has been offered for many years here, and there's only like 1 or 2 men who ever take that class. But he enjoyed it, and there was actually another man in that class, and basically I think he felt comfortable here, so he was willing to try everything we had to offer. He took a Reiki program. He also took advantage of healing touch, and he's come to talks that we've had about a cooking class here and things like that. So he's been able to take advantage of the programs we have and feel better about himself. Actually get some specific. One of the things he said that the Reiki sessions and Qigong made him feel better. And one of the things he realized with his disease, he could only really participate in an hour or 2 activity a day, and then he needed to rest and get ready for the next day. But he had a lot of self-awareness, so we definitely were working with somebody who had self-awareness, had motivation, but he was also looking for direction, because he had a large gap in his life. Whereas before he was working 8 to 10 hours or even more in the summer a day, he now had a lot of free time. So I think that was a benefit of being able to come to a center like the Beth Wright Center. And then we also, he had the ability, we sponsor, along with other organizations, conferences in Washington, an annual conference in Washington County, one in Bar Harbor. And we have a patient panel. So he had the opportunity to tell his story to a group of people at each one of these conferences. He did speak at both of the conferences. The one in Washington County, he spoke for about 5 minutes, and he did a good job, but it was very condensed, and you could see that I knew in talking to him that he had more of a story to tell. A month later was the Bar Harbor conference, and after hearing other people at, I think, at the Machias conference in Washington County, he elucidated on his journey in Bar Harbor. So now he spoke 10 or 12 minutes about what his experiences were, and you could just tell the importance that he had in telling his story. He talked about the fact that he was sorry that he hadn't taken better care of himself when he was growing up. He was probably harder on himself on it that he needed, but talking about drinking, and he thought he drank too much. Maybe that was the reason. Maybe he had gotten the cancer. And so by having this ability to reflect on what he was going through, I think that was also very beneficial. At the end of his talk, and in Bar Harbor, he said, although he does not know what his future holds, he feels good about himself, much better about himself each day, and just getting through each day and enjoying the moment. So I would just talk about, I think probably you can never have too many places to be empowered. And I think that in each place that a person goes while going through that cancer journey, you know, having that ability to tell their story, have somebody know that they're listening and showing concern for them is very important. And like that first slide, as I feel what we do at the Beth Wright Center is we can give people that 15% support they might need so that they can do then the other 85% of what they need to do. And that basically that's, we really can't live that person's life, all the time. And that's not what we're here for, and that's not what we should do. But, empowering people to giving them that inspiration and support to do what they need to do is important. So again, like in the Beth Wright Center, in many ways, we complement what is going on in the treatment world. I think we taking that holistic approach to helping people, and we work much closer with the medical community than we did 15 years ago. But it's, both of us having this, working together, having this integrative way of helping people is very important.
Yeah. Michael, I'm curious, hearing from anybody else on the call too, if there are ways that, or if there's like a common thread that you've noticed among patients who are similar to the case that Michael just described. Like what are some ways or methods that patients have used to kind of take control and feel empowered, not just with maybe clinical care, but other aspects of their life too? Or do you have patients who are similar to what Michael's just described?
I was honored to speak at a patient support group, and it was to talk about marijuana. And it was very empowering for the patients to have a voice in how they want to use that as they talk with their providers. So I feel like that was some empowerment for them, to have clarity of the information and to have clarity of information provided to them so that they can have a language to discuss it in a medical context with their provider. So I thought that was good. Just thought I'd start that in.
One of the things that happens at the Beth Wright Center too is we remind people of the support services that are at their treatment centers and things like that. So I think we reinforce a lot of the support that's out there for them, and I think we reassure them that most of the people we deal with, all the people we deal with and support services at the different treatment centers are caring, great people who their services aren't taking advantage of it a lot. So it can, we feel that we reinforce what's happening during treatment for them and make sure of it, or not make sure, and try to tell them to take advantage of those services.
Yeah. Have any of you found that patients feel empowered by helping other patients who are going through a similar cancer journey? I don't know if there are any programs that you work with or more formal ways that you connect survivors with current patients.
I would jump in again. We certainly see the people who come to the center want to be able to give back in some way to others, no matter where they are on their cancer journey. And they can do that, by just giving them, it can vary how they do it, by just pat on the back, things like that, or tell them about a service that they took advantage of that that person might not have known about. So again, a benefit of the center is people they become experienced and knowledgeable themselves about what's out there and what's helpful, what could be helpful, and they can share that. And so, which is empowering. You know, they want to, they've been given so much help, they always want to give back. And that's a recurring theme here. There's almost that guilt of getting help without being able to give it, you know, returning it.
Are there any other examples of patients who have been empowered that any of you would like to share? Or methods or techniques that have worked for you? Okay.
I was just going to say that I think anytime that you can help a patient to do something successfully, their confidence grows, and that has benefits that can't be measured, right? So whether it's that they participate in a class at the cancer center, or whether it's that they call for their own ride, or whether it's, you know, that they ask their doctor a question that they didn't know how to ask before or weren't sure how to ask. I think that anytime that you help someone to be successful, you are building that sense of empowerment.
And I think the better they feel, the more they'll make sure they get to their treatment. You know, I think it'll reinforce what's happening in their cancer treatment regime. So I think it is I agree. The better somebody feels, the more they're going to do to help themselves.
All right. Thank you. We are at very close to the end of the hour. I wanted to thank those of you who had already completed the pre-assessment, and I will be sending out the post-assessment most likely tomorrow morning. That will come to you over email, and if you could please fill that out and be sure to leave your contact information if you want to be entered into a raffle drawing for an LL Bean gift card. Our next ECHO session will be on Wednesday, December 18th, and the topic for that session will be survivorship. I have a favor or a question to ask of those of you on the phone that I guess I'll check back in December. At the most recent Northern New England Clinical Oncology Society meeting, I think I see Devin's on the phone, who was also there with me. A question of how to best share resources in Maine kept coming up over and over again. So I just ask you to consider that and the way that you access resources. And you know, this group is the group that are the experts about how to do that. And it's a perennial question and problem that we've been facing. So I'd love to hear more about your thoughts, hopefully in December. Are there any other questions or comments before we go? No? Okay, well, thanks very much for joining us today. We really appreciate it. And hope you have a wonderful Thanksgiving break. I hope you get a break.
Thank you.
All right. Thanks. Thanks, Heather. Thanks, Michael. Bye-bye.
Thanks, Aisha.
You're welcome. Bye-bye.